I'm Katie Young from Activate Care. You are one of the thousands of people participating in our SDOH Masterclass series. For that reason, and for all the work you do in your community, thank you. We hope you enjoy the show.
Okay. Hello, everybody. Good morning, good afternoon, depending on where you are. And thanks so much for joining us today for Activate Care's I&R Professional Roundtable. We've had a tremendous response to this call, and we're really grateful that you've decided to take time out of your day to join us. We've got an interesting conversation ahead of us, we hope. And it's nice to see 41 folks on the call, plus our panelists. Today, you'll see that we've got a couple of folks with designated speaking roles, but really, this is an interactive call, and we've got a lot to cover, so we're going to jump right in. As I mentioned, it is interactive, and we would love to have you participate. There are a few ways to do that. So if you're familiar with the Zoom tools here, it's really easy. You can use the chat box to type in a comment, type in a message or an idea to share, and you can do that to the whole group. You can also raise your hand if you would like to speak, and we have the tools here to allow you to speak for a little bit, just to kind of share your ideas or ask a question live. And you can also ask a question using the Q&A button there. Just type it in, and we can answer it live as we go through the discussion. And just to give you a little bit of background about Activate Care, this might be your first time hearing about us. As a company, we're a public health company based in Boston, and we're on a mission to help the world act differently to achieve better health outcomes. We've been in business for 8 years now, and we work with hundreds of healthcare, social services, and government organizations across the country. And increasingly, we partner with 211 and I&R agencies. Our typical work in communities across the country is to help stakeholders integrate health and social care systems in partnership with various sectors in their communities. And our goal in this work is to help you save your team's time while improving health and social outcomes among the populations that you serve. And we have two moderators today, myself, Dan Kamick, Senior Director of Marketing for Activate Care, and my colleague Scott Pelrine, our I&R Market Director here at Activate Care. I'll invite Scott to introduce himself in just a minute. As for myself, I've been with the company for 5 years now, and really excited to see the company grow from a scrappy startup trying to change healthcare, which, as you might imagine, is no small feat, to the really well-established and nationally known company that we are today. My background coming into Activate Care was actually in community health. I worked at a large FQHC in Boston called Fenway Health, which also had an affiliate organization called AIDS Action Committee, an AIDS service organization. So I think between the FQHC background and the ASO background, I might share a lot of experiences in common with many of the folks on the call today. And thank you for joining us. Scott, why don't you take yourself on mute and tell us about your background?
Thank you, Dan. I'm honored to be here. I am the director of our partnership initiative with United Way's 211, an information referral specialist around the country. I've been with the company for about 1.5 years. I come with deep roots in healthcare, about 25 years, starting off as a community health center, community behavioral health center in Lawrence and Lowell, Arbor Health Services, driving intervention in communities. And I'm very honored to be a part of this today, and I'm looking forward to hearing from the community of United Ways and 211 and information referral specialists across the country.
Great to have you here, Scott. And so I'm sure many folks on the call have spoken with Scott, and trust me, he's a resource in this work. And so I hope you've enjoyed those conversations. And so let's jump right in, as I mentioned. And what we'd like to do here is to kind of open up the discussion here with a trivia question. And so we have the latest data on needs that 211 organizations specifically across the country are dealing with. And I'll do a big reveal of this data in a moment. You may be familiar with the national trends, but I'm curious, in your view, which of these three needs experienced the biggest year-over-year change between 2019 and 2020? And obviously the biggest factor in this is COVID-19, the pandemic and the economic impact of that. And so you can use the chat box to throw in your answers. And so we've got a few coming in. Appreciate that. This is a good time to get accustomed to the chat box as well for participating in the discussion to come. So take a look for that. Really good answers coming in. let's see, some different guesses and perspectives. A lot of participation in that. Love it. All right, so last call for answers. 3, 2, and 1. Okay, so a lot of guesses there. And the key way to think about this is what's the biggest change in these needs? And so it's a bit of a surprise, I think. This data is actually coming from the Focus 19 group out of Washington University in St. Louis. And so what they do is they collect data from 211s across the country through 211 counts. And I think they have nearly 30, maybe more than 30 states represented here. And this is what they found. The data coming from your own INR system shows that home delivered meals experience the biggest change. And then the obvious suspects, rent assistance, help buying food, paying utility bills, and dealing with issues related to keeping safe in your home as rounding out the top 5. I think it's important to note, home delivered meals might be a bit of a surprise answer there, but really probably it's just the swing change from October 2019 to October 2020. That's interesting there. Scott, I want to ask you to chime in on this based on your conversations, but before you do that, we have a question about the slides and the recording. So I should have mentioned that up front. My apologies, but yes, this is being recorded and we will share the slides as well. It typically takes us about 24 hours to get that out to you. So we'll send that out in an email. But Scott, coming back to this question, what are your thoughts on this?
Yeah, I'm really surprised by this, Dan. I've had a lot of conversations across the country with United Way's 211s and INR specialists. And at the beginning, for the first 6 months of the pandemic, food insecurity was the largest. And then it went to up and down with rental assistance and utility assistance. But over the past month, I've seen a drastic increase from the calls I've had with 211s and rental assistance and landlord-tenant issues because the eviction bans are being lifted in major cities and counties and states across the country, and the need for this resource is really prevalent right now.
Yeah, I think everybody would agree with that. So let's keep going with some of the other trends. We just have one more data point to share, which is where COVID-19 is impacting these non-health needs the most across the country. So working on from that time frame of around March to November, these are the top 15 communities across the country. 2 of those are in our home state, Massachusetts, and we'll hear Paul Mina speak to that in a few minutes. I think we have folks from some of these communities on the call, right, Scott?
Yes, Dan, I believe we do. I believe we have some people from Hawaii. I believe we have some people from South Dakota, and also New York and Massachusetts.
Yeah.
Anybody?
Well, thanks for joining us. Exactly. Scott, I'm glad you said that. We got Maryland here. Thanks for the shout out. Feel free to raise your hand. Maui and Houston. Love it. And so this just goes to show everybody across the country is in the same boat, including Wisconsin. And we'll talk about some of the specific challenges happening in your communities in a little bit. There will be a point where we asked some questions in advance of the call and we got some great responses and we'll pull those in. And so, Scott, I'm glad you just said that. If anybody does want to speak, just raise your hand. And there will be a lot of opportunities to exchange ideas or just kind of reflect on your experiences in this work. Indiana here, great to have you. And so I think, one of the things that the national interest in this call represents is the fact that we're all seeing the same challenge. And I wanted to pull this quote on here because, you just saw the top 15 counties in the country where the need has changed dramatically. And from your perspective, sitting in the shoes of 211, of an INR agency, you obviously have a group of organizations in your community that you refer people in need to. And they're experiencing the same challenge as well of extra, skyrocketing demand but revenue challenges. And this is a quote from Tim Delaney, the president and CEO of the National Council of the Nonprofits. They have 25,000 members, the community-based organizations that you all work with. And he said that everyone's losing revenue and many organizations face skyrocketing demand. So you do the math. And I think what this signifies to us here at Activate Care is that, looking at 2021, which is just around the corner, going into the new year and trying to do the same thing that you've always done is going to be a challenge. And not just for you, not just for us, but also for the incredible community-based organizations across the country who help people in need every day. And so we really need to take a fresh look at how we're operating and the way that we're thinking about building networks of organizations that can meet the need. Scott, I think you were thinking about that too, right? Just in terms of reflecting on this quote and what it says about the state of the nation.
Yeah, these conversations are very hard to have when I'm speaking with 211s. Recently, I had one in a state where the COO of United Way, who's managing the 211, literally told us that 30% of the CBOs will be gone by the end of the year. And we'll have less resources in our resource directory because they will not survive. It's happening across the country, Dan.
It is, and as we said, it's happening in our own backyard. And so I'd actually like to invite Paul Mina to speak about that a little bit. So we'll spend 5 minutes with Paul just to kind of go in a little bit of detail on what's happening locally with community needs and with some of the strategies that Mass 211 and United Way of Tri-County has undertaken in recent months, and also how you're looking to the future. So Paul, if I could invite you to unmute and maybe jump in.
Good afternoon. Can you hear me?
We can, yeah, thanks.
Well, great. Well, thanks for having me, and we appreciate the opportunity to be part of this dialogue today. I have to tell you that it says that we have an unstable internet connection from time to time, so I hope that the voice doesn't fade out. If it does, just send me a chat or a note, and I'll try to figure out what's going on this end.
Okay.
For Mass 211, which is a wholly owned subsidiary of the Council of Massachusetts United Way system, and a program of the Commonwealth of Massachusetts, it's a partnership, public-private partnership. We have had a very difficult, but very challenging, but successful last 8 to 9 months with COVID-19. Not unlike everybody else, I think the demands on our system were very similar. The governor, we are the official hotline for emergencies in Massachusetts all the time. So this was not unusual for us to be called upon to become the official direct telephony solution for the citizens of the Commonwealth when this began in March. So, we've had very, I don't want to say complicated, but very dynamic relationships with DPH, with MEMA. We're under contract with the Massachusetts Emergency Management Agency. They've been wonderful partners of ours for years, as has been DPH. We also now work with DHCD and some local nonprofit mental health organizations like Riverside, the Office of Child Advocate, Mass Legal Association, and our friends at Activate Care are part of our partnership with direct service provisions that we try to bring the people of the Commonwealth every day on both our hotline, which is a telephony solution, and on our website, which is called Mass 211 Help Steps. And I think that, like every 211 in the country and the United Ways that house, operate, and support them, we've had to deal with, a number of issues, not the least of which is the fact that, answering the call requires a lot of work in advance. And when the governor activated us for COVID-19, we had to be prepared with the database to make sure that everything that was necessary to be rightly positioned within the database regarding COVID-19 was there. It required a lot of oversight, a lot of review and triple checking, garbage in, garbage out. So you have to have the right information there. We were very fortunate that the Department of Health, DPH, was able to embed a significant number of their staff from their epidemiology department to be housed within the 211 headquarters so that they could give us technical assistance and help answer the huge volume of calls. Since March, we've taken 153,000 COVID-19 calls, and the calls get longer, not shorter. They're more emotional now, they're more complex, and a lot of the folks that call us end up getting referred to our Call to Talk mental health suicide prevention line, which is part of the statewide Mass 211 platform. One of the good things that has come out of this, it really is the way that we've been able to cultivate and grow our relationships with other organizations like the ones I mentioned before, and a myriad of others who have now decided that they understand that 211 exists, and that they want to see if they can partner with us during normal times. So the opportunities that are presenting themselves as a result of our involvement with COVID-19 and the fact that our governor and the DPH people and the folks at MEMA seem to be very happy with our work. And we've had an awful lot of, I'd call it free publicity, because they've had our name and the Mass 211 number all over the signs along the road here in Massachusetts, a lot of television, radio coverage. If it wasn't for the fact that it was a pandemic that was driving this, it would be a great public relations boom. But the fact of the matter is, it's as a result of a terrible virus that has raised havoc with a number of families, hundreds and thousands of families in Massachusetts. So, from the 211 perspective, I feel strongly that 211's niche nationwide should be as the telephony solution to crisis and emergency. People that know me know that I have this vision someday of every person in the United States has a 211 United Way magnet on their refrigerator. And that when there is some kind of a calamity or disaster or emergency, that people turn first to 211 because it's the most easy place to turn to get that information. And we do our best across the country to make sure that the information is correct the first time people call. I still think that that should be where we are. And I still believe that that's a place that we can really realistically be if we continue to build on what really has been a reputation booster for most 211s across the country, if not all. So to the extent that we have partners like Activate, I think that that's a great opportunity for us to grow the network, to grow our relationships with the healthcare field and others. That's why we've gotten an arrangement with them here in Massachusetts to work together. They came to us and they wanted to use our database. They didn't just go in and scoop it off the internet. They came and they wanted to do it the right way and build a relationship with us. And that went a long way for us because of their honesty and straightforwardness. So I think this is an opportunity for us to strengthen ourselves as a network. And, I look forward to any more dialogue that we can have around this, because I think that we have a destiny that is shared. and that is to provide the best quality information and referral for people every day as well as during emergencies and crisis.
Thanks so much, Paul. On behalf of the Activate Care team, just thanks for the kind words about the work that we're doing together. And we share the mission with you, which I think, you know, every single member of our team feels deeply. And so I'll invite you, Paul, to come back and speak on any of the topics that do arise, to offer your feedback or advice to anybody else in the call. Same with your colleague, Eileen. And just kind of getting into that discussion, which I think, Paul, all of your remarks really take us in a good place for a productive dialogue. But really just honing in on what you said, you know, the pandemic has reminded a lot of stakeholders and organizations in your area that that Mass 211 exists, right? And so hopefully this can be a catalyst for partnerships to help your organization survive during a time of chaos, but also to thrive in normal times. And it really is, as you said, during a time of chaos or crisis when the power of INR emerges. And just pulling an example from, you know, a different place in the country, down in Fort Myers, Florida. This is from Janine Joy, the president and CEO, who is speaking to her local newspaper, just saying, we have a lot of people right now who are calling for the very first time because they've never really needed help before. And as we all know, navigating social services is really difficult to do. Paul, I think as you were speaking, you probably had a lot of heads nodding along, and I think this quote is another, you know, anybody could have said this, anybody on the call. And I think that speaks to the challenge facing 211s, and we heard about that directly from Finger Lakes 211, who may be on the call as well. And if you are, I encourage you to raise your hand and feel free to kind of expand on this. You know, you mentioned we're seeing an increase in positive cases, which contributes to increased fear and anxiety amongst community members. If you are here and you do want to speak, just raise your hand or drop a line in the chat box. Paul, you mentioned this as well, that the calls around COVID are getting longer, not shorter, and they're getting more emotionally complex. We also heard from 211 in Michigan, who took over the statewide COVID hotline, much like Massachusetts 211 did a few weeks back, and the calls are primarily about test results and how soon they can be provided, which isn't really information that you can share. They also often turn to complaints and anger, and that's an increased challenge on the staff. And so I think we ask this question first: how is your community doing in the midst of the pandemic? Because it's on everybody's mind, and you're in a group of people now who are sharing that experience. So we'll just pause here for a few seconds and ask if anybody does want to weigh in on that. The line is yours. If it comes back to you in a bit and you do want to chime in, feel free or drop a line in the chat box. We did ask some other questions, and we'll think about, you know, what we're coming up against now at the end of the year. And I think the facts are clear. This is different from anything we've ever faced, which again is why we're having this call and why Activate Care reached out to all of you, reached out to Mass 211, and decided to embark upon a partnership. Down in Texas, this is Amanda McMillian speaking to the Houston Chronicle, saying the needs are so much greater than they have been in the past. It's across the entire community. It's dramatic and it's sustained. And again, I'm sure this resonates with all of you. It's what I heard in the responses to the questions. Scott, I'm sure you're hearing this in your conversations across the country too.
Yes, I'm hearing it from all the United Ways and 211s, and it's growing. So it's becoming more dramatic, as she says here. And I know that we have Griselda Sanchez on the line from Houston. Griselda, would you like to speak to that at all?
There's a bunch of folks that we can invite to talk, and obviously we don't mean to put you on the spot, but the floor is yours if you'd like to take it. The other feedback that we've heard on this point, we were specifically thinking about how to exchange ideas to help more people during the holidays. And so we heard from Arkansas, needs are going up, and the concern is that we could potentially see another shutdown of restaurants and bars. And that would be extremely problematic in their community, like many others, as they rely on the tourist economy. If that's something that you're struggling with too, or thinking about strategies for building a stronger support network in that area, maybe raise your hand there because other folks are asking that question. One strategy is to think about volunteers and what volunteers can offer in terms of support for your staff, maybe prioritizing certain services for your trained resource specialists and using volunteers for more of the stuff that you would get to when you could get to it, but you obviously can't get to it now. If you do have any other strategies around kind of preparing for the holiday season and you want to share that, just drop it in the chat box. And Paul mentioned this, partnerships are a different beast now, and there's a lot of opportunity there. Before we do that, there is somebody who might want to speak, and that's Lisa. So Lisa, I'll offer you that. Feel free to jump in. In terms of these partnerships, we look at them as critical. They're critical for all of our organizations. And we really should be thinking about ways to build these partnerships in a way that really is designed to meet the needs of your specific community. And offering from Sarah Clark over at N4A, the Elder Care Locator just announced a Home for the Holidays campaign focused on social isolation and their ideas for increasing connection with community as its focus. That's a really impressive program, I think, because it focuses on a need that every community is dealing with, right? Which is social isolation. Paul Mina was speaking about their call service for suicide prevention, and that's another way to offer that helping hand in the community. Carmen, thanks for jumping in there. For the holidays, we've hired some temporary staff and utilizing volunteers to assist with data entry. I think that's a smart strategy as well. Volunteers might come with a certain set of skills as well. I remember one organization, it may have been yours, Carmen, but I don't want to quote you on that, saying you received support from the local utility company, call center staff there specifically, who were actually a quick study and could jump in for more tailored support on the helplines. Sarah, I'm glad you mentioned that you'll have the resources available. We're happy to share that out with our network as well regarding the Home for the Holidays campaign. And so just thinking about some other ideas here. Actually, before we do that, Carmen, I'd like to invite you to speak too. And you might have to unmute your line to start talking, but it's all yours if you'd like.
Oh, I was just going to say, what I was going to just talk about was a unique relationship that we forged through all of this. And I know everybody's had to get innovative and think outside of the box, but our 211 has always had a really good relationship with our food bank. But when COVID hit, most of the time people would complete food vouchers and then take them to, they would call 211 to get connected to a food voucher, go to a church, pick it up, and then go to the food bank to redeem it. With COVID, that could not happen. And so we actually worked with a local food bank and we created a virtual voucher system. And so basically 211 can actually enter people's name into the Google Doc, which is our virtual voucher, put the information in there, give the individual the voucher number, and they could actually go to the food bank and redeem it and pick it up. But then we had a lot of people who could not pick it up, and mainly our elderly or maybe people with disabilities who didn't have transportation or were at high risk. And so we forged a relationship with our local transit, which is CARTA, because they weren't picking people up because of COVID. And so they decided to do that for us. So they would load up their buses and take these boxes of food to people every day, and whenever they needed it. And so CARTA started getting busy again. In June, we developed another relationship with St. Alexis, who works with the elderly, and they have been delivering food boxes for us ever since. And so this is just one agency leaning on another in order to get it done. And so that has been like a great relationship in the community. I don't think that these individuals could have received food had it not been for the three agencies working together. So I just wanted to share that.
I'm really glad you did, Carmen. I appreciate you sharing that. What part of the country are you dialing in from?
Chattanooga, Tennessee.
Great. Well, thanks for joining us and thanks for sharing that. I'm just wondering if anybody else is doing something similar for food delivery. Obviously, if you look back to the data from Focus 19 that we looked at the start of the call, delivered meals is the need in the country that has experienced the sharpest increase out of all needs, or the sharpest change, rather. And so really impressive work that you're doing there to kind of make the meals available and then also get them to those who are most in need and can't go pick them up. That's the kind of critical partnership that needs to be happening. And perhaps in terms of taking a fresh perspective on those partnerships, maybe those kinds of things need to be happening all the time and not just during the pandemic, right? Right. Here's a quote from Shannon Callahan, who's in Portland, Oregon. Again, a totally different part of the country, one that's experiencing a significant problem with housing needs. And in this time of great need, having these broad community-based partnerships is critical to getting housing assistance out to those in need who are too often left out and left behind. Portland Housing Bureau partnered with their local 211 to build a streamlined housing assistance program. Unfortunately, the demand far exceeds their capacity there, but this is a step in the right direction and a partnership that will hopefully grow in the years ahead. Speaking of partnerships, this I think is where everybody's interested in maybe learning from others. So if you do have something in mind or you have a question, remember you've got 60 odd people on the call, all in the same position. So feel free to type that in the box or just raise your hand like Carmen did. And so this is from Kerrville First United Methodist Church. I believe they're down in Texas. So they partner with the San Antonio Food Bank. Again, similar to Carmen, your work to be able to purchase food at a reduced rate. They're more on the service provider side, but they are definitely connecting the dots for people in need because they also partner with businesses, hospitals, churches, schools, and individuals, and they volunteer to help in those weekly food donations. From Sarah Clark at N4A, we're seeing increased partnership and contracting reported between local area agencies on aging. Obviously, huge INR players in our local communities. Partnerships between the AOAs and community-based organizations and medical institutions, especially around discharges. Sarah, I don't mean to put you on the spot, but I think it might be interesting to hear that because that's often a time of extreme vulnerability for people coming out of the hospital, especially if they're recovering from COVID. The post-acute care for COVID is really difficult. And so if you'd like to just add a little bit more on that, yeah, definitely. Here you go.
Hello, this is Sarah. Can you hear me okay?
We can. Thanks, Sarah.
All right, hi. We at N4A, we have the Business Institute, which focuses specifically on those that, specifically contracting, especially right now and for the past several years around partnering with hospitals and other medical-based organizations. And it's been traditionally really difficult for AAAs to do, although there's been more and more of it over the years. But this, unfortunately, took COVID, but it does seem like there's a slight silver lining around that as well, is kind of this sense of, well, what's happening at home is so much more important. So whether it's telehealth or discharges or, realizing that if people don't have food, they're going to keep coming back to the hospital. We don't want them there. So there's just been a slight uptick. We did a survey, both a membership survey, like right around just before COVID, like just for March, I think. And then we did a COVID specific survey, and we did see not a huge uptick, but a little bit more in the way of partnership and openness, and the medical hospitals and nursing facilities and stuff doing more proactive reaching out than we've seen in the past with their AAAs, or more willingness when the AAAs reached out because of COVID and trying to keep people out of hospitals.
Yeah, definitely a challenge for not just the hospitals, but for everybody trying to help those individuals. So thanks for sharing that, Sarah. I'm sure other folks are seeing that in the community. And I'm glad you mentioned the Business Institute there, which is a great resource that we've become familiar with as well for CBOs trying to, maybe correct me if I'm wrong here, Sarah, but trying to navigate the healthcare partnership realm.
Yes, exactly.
Great. So definitely encourage folks to check that out. I think another example of this that came from 211 Michigan. So statewide, they partner with their Department of Health and Human Services, similar to Mass 211. They have 7 centers, various partnerships, mental health professionals, healthcare providers, even cybercrime, to name a few. One of the challenges they raised, because with collaboration, of course, that brings its own set of challenges. It can be difficult to track what everyone is doing within one database and still maintain a customized taxonomy system and do the valuable work of assuring consistency and quality. And I'm sure there's a number of other challenges. So if there are things that you're thinking about might be looming as you embark on partnerships with various organizations, now's a good time to kind of express those as well, because we've got folks like Sarah on the line, or others in your position like Carmen who kind of have thought about this, and also yourselves with expertise to share. Scott, I'm wondering what kinds of partnerships you've been talking about with different 211s and United Ways and INR agencies across the country.
Well, we're talking about, what I'm seeing across the board and across the country is a movement going away from assessing and referring to screening and intervening. And the 211s, the United Ways, and the IR is driving intervention in the community. No longer is it suffice enough to, take a phone call and give somebody a few numbers and hope that they get the resource. We're seeing a lot of partnerships on intervention within communities, mental health agencies and organizations coming together with the 211. A lot of that is happening right now. And substance abuse is another big one that's really come to the forefront during the pandemic. And 211, seeing a lot of 211s partner with programs that provide, substance abuse management and mental health services.
I think that's, we're seeing that where maybe 211s are seeing, again, the power of what you offer the community and kind of rethinking what role you'll play in the year ahead and in years ahead coming out of the pandemic. And Scott, I'm glad you mentioned that, because I think, what we advocate is this notion of community information exchange. We started Activate Care from the healthcare perspective. We like to say we were born at Boston Children's Hospital, really focused on care coordination, especially for complex cases, people with multiple medical challenges or medical and behavioral health challenges, and especially in the pediatric setting, there's a big toll that takes on the family, children with medical complexity, for example. And, that type of population receives care from a lot of different angles, right? They have home-based care. They get care in the school system. They also have multiple specialists. And what we heard along the way is that you really can't do this in a healthcare only vacuum. You really need to engage the community. Hospitals have the benefit of health information exchange, albeit at different rates across the country and depending on the organization. But, there really isn't that kind of approach for community services. And so we've heard these common themes from both the responses that you've shared with us over email and some of the comments that you shared today. This is really a challenge and an opportunity for the information and referral sector to play a larger role. As Paul said, this is incredibly valuable data that you offer the community. you really need to think about the role that it can play in an ecosystem like this, a community information exchange approach. Scott, we're just about to wrap up. So is there anything else you would add on this kind of network approach?
No, and I think this is phenomenal. And I think that this is where 211s are going in the future in United Ways. Having that collaboration amongst the community and everybody looking for better outcomes for patients is where they're all aligned. One of the things I do see, Dan, is I'm seeing a drive of closed loop referral management and 211s trying to get to that spot, which goes hand in hand with driving intervention into the community.
I definitely agree. And intervention is the key word, right? Really rethinking what a referral means right now, given that so many people have so many different types of needs. Can a referral really solve that need? Or do we really need to look at it from a community angle and try to develop coordinated interventions encompassing all these sectors that you see on the screen, both healthcare and social services, as well as behavioral health and even criminal justice and the education system and all of the different stakeholders that play a part in this. Building a network and investing the time in kind of formalizing these relationships pays enormous dividends, not just during a time of crisis and emergency. And so I want to thank you all for joining us. I think, we'll wrap it up here, unless, of course, you have questions and you want to get them out right now, because we do have the time. But from my perspective, Scott, I think this was a success in terms of getting everybody on the call and kind of reminding you you're not alone. This is happening across the country, and we have no shortage of empathy for what you're seeing out there. Scott, any closing words for many of these folks that you've already spoken to?
Yeah, well, thank you everyone for joining us today. I appreciate your time. We appreciate the work you do. We're aligned 100% with your mission, and we want to look for ways to support you in this mission also. You will be hearing from me probably, and I look forward to talking to you in the future, all of you, and looking for ways to help each other and support each other through the pandemic and beyond the pandemic.
Thank you, Scott, and thank you, Dan.
Thank you, Paul. It was really great to have you, and thanks to the folks who chimed in as well. Really appreciate you sharing your ideas and your expertise. And we'll get the recording out to you as soon as we can, as well as the slides and some of the resources that were mentioned. And as Scott said, if there are ways to partner, we'd love to explore those with you. So with that said, we'll leave you to it. Have a great rest of your day, and thanks for all the work that you do in your communities.
Thank you so much for watching. If you enjoyed it, you should let us know. Head over to our website, activatecare.com, and use the chat box to connect with one of the friendly folks in our team. We're here to help. It takes a community.